Researchers first chemically removed all the cells from a donated ovarian tissue. This left a bare tissue scaffold made up of proteins and collagen. Isolated human follicles were then grafted on this decellularized follicle are tiny sacs that hold early-stage eggs. The immature eggs and ovarian tissue scaffolds were then reintegrated successfully. This structure resembled an artificial human ovary. The artificial ovary holding human follicles was then implanted into a mouse, which supports the survival and growth of early-stage follicles. Blood vessels began to grow around the ovary to keep it nourished in the animal. A quarter of human follicles survived for at least 3 weeks. Researchers hope that this artificial ovary could be implanted back into women to restore their fertility after cancer treatments. Implantable artificial ovaries could also help women with other conditions, such as multiple sclerosis and the blood disorder beta thalassemia. These conditions require aggressive fertility-harming therapies that leave women infertile. Artificial ovaries can also help patients who go through an early menopause. It could help women restart their menstrual cycle without the need for harm. The treatment could be ready for human trials in the next few years. Currently, there are 2 fertility preservation treatments available for women. Women with damaged ovaries can freeze their eggs, and also they can try in vitro fertilization (IVF) at a later date. Another way a woman can preserve their chances of conceiving is ovarian tissue. This procedure involves removal of a healthy ovarian tissue and freezing it before the medical treatment. Once the patient is healthy again, the ovarian tissue is reimplanted. But there is a risk that in those with cancer, the ovarian tissue may contain cancerous cells, which might potentially reintroduce the cancer once it is implanted back into the body. Both IVF and ovarian tissue transfer can also impair the viability of eggs.